My name is Dr. Jose Easow. Um, we started the bone marrow transplant program at Apollo Chennai in 1995, and in 2000, the year 2000, we completed 100 transplants, and as of 2018, this year, we have completed more than 1,100 transplants. So we have done transplants for various indications. So we have done transplants for more than 40 indications, of which 15 are for malignant disorders, meaning like acute myeloid leukemia, acute lymphoblastic leukemia, non-Hodgkin's lymphoma, Hodgkin's disease, and so multiple myeloma, and many more. And the balance 25 or more are for benign diseases such as aplastic anemia, thalassemia major, sickle cell disease, Fanconi's anemia, and so forth. And the types of transplants are one of them is autologous stem cell transplant. That means the patients themselves are the donor to rescue them, and this is mainly done for malignant disorders. For example, acute myeloid leukemia, Hodgkin's lymphoma, non-Hodgkin's lymphoma, multiple myeloma. And whereas for the benign disorders, somebody else who is a HLA matched has to be the donor. Majority of the time, it's a related match to transplant. For example, the brother or sister, very rarely the parents would match. And we were the first hospital in India to do a related cord blood transplant. That was in 1998. And we are the first hospital in India to do an unrelated transplant, which was in 2007. Subsequently, we have done for more than 150 patients unrelated transplants. Generally speaking, the success is very difficult to tell because it's for more than 40 indications. But if you take an average for malignant disorder, the success is 30 to 60%, and for benign disorder, the success is somewhere between 60 to 90%. And there are complications that could happen. The risk of death is there, with and that's close to 10% or slightly higher for allogeneic transplant. The risk of relapse is there, depending on the condition they're getting transplanted. And with allogeneic transplant, the risk of graft versus host disease is there, which is about 30% of the time this could happen. But if they overcome all this, then the success is, as I said earlier. And we are able to do the transplant at 1/10 of the cost what would cost compared to the West. And there are select indications. For example, they need a allogeneic transplant and they do not have a matched brother or sister, or they do not have a parent who is matched, or they do not have a unrelated donor, or they cannot afford an unrelated donor transplant. Then the option is half-matched transplant, which is known as a haplotransplants. This too we have done for more than 20 or 25 patients.